Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to try and make a better system for all of us. Today we're going to talk about reproductive health and other things, but before we do, I want to point out that down below in the YouTube description box will be a link to the Healthcare Advocacy newsletter, which has all the backup material, analysis, and references that I discuss, as well as actions. And you can, of course, subscribe for free there and get this delivered to your inbox every day. So let's talk. National Public Radio reported this week, and of course there's a link so you can listen to it, about the state of pregnancy care in Louisiana. That state has one of the most severe abortion bans in the nation. Doctors can be fined up to $200,000 and lose their medical license and, get this, be sent to prison for 15 years for violations. Doctors are scared, as are patients. Women with ectopic pregnancies or miscarriages are being mistreated and allowed to have their health deteriorate to near death before intervention because doctors are so scared. Typically, an abortion is the standard of care to maintain a woman's health and future fertility in the event that the pregnancy is just not viable. But not now, and not in Louisiana. In fact, a recent report by Physicians for Human Rights, and there's a link and you can subscribe to their newsletters as well, doctors described cases of women who experienced preterm premature rupture of membranes. You can read that as water broken. Early in the pregnancy, long before the fetus is viable, and some of these women were forced to undergo cesarean section surgeries to empty the uterus and avoid infection, instead of just receiving a simple, safe abortion or abortion medication. You know, they forced them against their will to go through major surgery. If there is a membrane rupture prior to fetal viability, a C-section is not the standard of care. Abortion is. This is major surgery and carries significant risk and long recovery, and it is very difficult. Anyway, this is actually the least safe thing that you could do for that patient. One OBGYN commented that this is what's in the best interest of the physician, protecting themselves from jail and prosecution, not what's in the best interest of the patient. Doctors described another serious deviation from standard medical practice, and this one was really scary. OBGYNs in Louisiana are now delaying routine prenatal care until patients reach 12 weeks of pregnancy, the point at which the risk of miscarriage drops significantly, because they don't want anybody to think there was an abortion. Delaying pregnancy care into the second trimester can be dangerous for people who might have complications, like a history of blood clots or ectopic pregnancy that goes undiagnosed. Without treatment, some pregnancy-related problems can lead to birth defects, stroke, heart attack, or even death. This is what happens when politicians decide to push false religious doctrine on the public instead of allowing doctors to care for and save patients' lives. By the way, major evangelical churches used to be pro-abortion because they cared for women. That change was a capture of churches by political activists in the 70s. We can discuss that another time. Anyway, we need to take action about this, and we need to overturn this kind of terrorism at every level, locally, statewide, and nationally. So, number one, make sure you vote for politicians at all levels who support the right to an abortion. Let's tell our member of Congress and our senators to get in gear and pass these 4 routine laws. Their contact information is in the resources section, and I'll just tell you what the bills are real quick. It's the Women's Health Protection Act that restores abortion rights, that restores Roe versus Wade, the Protecting Access to Medication Abortion Act, and the Right to Contraception Act. The reason for that is that the same people who didn't want abortion, they also want to outlaw contraception. Okay, that's a lot. You can use ResistBot easily on your cell phone. Just send a text message to 50409 And what the text message is, sign, SIGN, space, PKB CSE. Let me repeat that. PKB CSE. Sign PKB CSE. And you'll send a message to your member of Congress and to your senators to ask them to make sure that those bills get passed. And it'll actually send them the link to these reports so that hopefully somebody on their staff will read this stuff and take it to heart. Okay, so that's so critical. I think we go through this over and over again, going through these messages. I want to make sure that all these bills go. Oh, you know, the last bill, I didn't mention it. I said there were 4. Women's Health Protection Act, protecting protecting access to medication abortion, the right to contraception. My God, I forgot the most important one. Pass the damn Equal Rights Amendment. You know, that's actually also in the email that you'll be sending to them. Let me talk briefly about measles. The CDC issued a measles alert. This is, we had this in 2019 and we've got it back again. Measles is a highly contagious viral illness. It can cause severe health complications, including pneumonia, encephalitis, which is inflammation of the brain, and death, especially in unvaccinated persons. Measles is highly contagious. One person infected with measles can infect about 9 out of 10 unvaccinated individuals with whom they come in contact. Actually, there have been some cases where it's been far more than that. The Center for Disease Control and Prevention issued a health alert network advisory on March 18th, 2024, to inform clinicians and public health officials of an increase in global and U.S. measles cases. And of course, there's a link to it in the newsletter. Go read it. They especially would like to have travelers, people going out of the country, vaccinated. That is so important. International travelers greater than 6 months, all children greater than or equal to 12 months who plan to travel internationally should be vaccinated. And adults, you need to make sure you're vaccinated unless you were born a really long time ago. 93% of the cases that have been reported in 2024 are linked to people who brought back measles from overseas. MMR, the vaccine that does measles, mumps, and rubella, is safe, it is effective, it is readily available at almost all commercial pharmacies. Go get it. Healthcare providers should ensure that children, anybody coming under their care, should make sure that they are vaccinated. I reported on about a week ago, I think, about a doctor in California who decided he had had enough. If you're bringing in kids and they are past the due date for measles and you have not vaccinated them, take them home. He can't have them in his office because you're just going to make other people sick. There should be consequences. Anyway, the vaccine is safe and effective. It's readily available at all commercial pharmacies. Make sure that little ones are vaccinated. And if you were born after 1956, please check if you need a vaccine with your healthcare provider. 56 was the cutoff point for that. Okay, that's what I've got for you today. Down below, you can like, share, and subscribe. Send me comments down below. I'll try and answer them, or you can send them to healthcareadvocacy1@gmail.com. Have a good evening.